The care at CareATC is different than what you would get anywhere else in that we provide quality care and we're measured based off of how well are we providing services as opposed to how much service are we providing. You can expect when you walk into a CareATC healthcare center that you would be greeted as a person, not as a number. So none of the, sign in please and then sit over there and grow cobwebs.
We really instill not only within our clinical teams and our provider teams, but the front office to make sure that they really connect with the patient, understanding the patient, understanding their family dynamic. We meet the family, we meet the kids, so being able to connect with them on a level where it's comforting coming into the clinic, especially for those that have never been into an office setting.
Clinical excellence can sometimes only indicate a cold fact, right? So what we do is we try to make sure that we are taking the human element in that as well. So we realize that quality metrics are fantastic and we want to strive to be as good as we possibly can be and have the individual achieve the results that they wish. However, we also know that sometimes there are barriers to our patients getting to where they should be. Whether it's, they're having internal struggles, they're having some mental health issues, there are things going on in the home, maybe the finances are not so good. So trying to marry up that, yes, we want to be clinically good, but we also want to understand what are the barriers that our patients have to achieving goals.
On average, we're less than 3 minutes with our wait times, and so getting them back into the clinic, into the room with the provider and spending quality time face-to-face with the provider to make sure that we understand not just what they came in for, but the whole patient. Main Street, or when you look in the community for service, it's really treat and street, how many people can we get through the door? With our model, it's really about the time spent with the patient, understanding, again, whole patient care, and really being able to develop a care plan and a journey for that patient to be able to educate along the way.
We care about our patients. We care about trying to achieve the best care that we can, to achieve the best quality metrics we can, and to have the best and most friendly place that you can come to receive your care where you feel like family. That's why I like being here. And again, it's all in the name, it's care.
Healthcare is fragmented, it's complex, and for those that have never seen a primary care provider, it's really confusing when referrals are made to a patient. How do we go and connect them? And at CareATC, one of the things that we really ensure is how do we make it easy for the patient to navigate that system, and how do we provide those warm handoffs to do that? We do expect, a platinum experience within CareATC. We measure patient experience throughout, all of our clinics. We look at that from a national roll-up standpoint, and it's really important. We live it within the culture of the organization of how we treat each other, but we also expect that platinum experience for each and every patient that comes through our clinic.